welcome back. If you're just joining us, welcome in. This is ANAD's Day of Conversation. And before we get into our next incredible conversation, I hope you had a really incredible time listening to the conversation with Rural Minds. But just a quick reminder for everyone, we do have a raffle going on today. Alsana is working with us to give away a really incredible self-care basket. So if you haven't gotten tickets yet, you can scan this QR code right here and you can get some and be entered for a chance to win. And we will be doing that tomorrow. But now I am really excited to pass it off to Athena, one of ANAD's program coordinators who works with our support groups. And she will be talking with some of the really amazing members of the Body Empowerment Project. So with that, Athena, why don't you take over?
Hi, everyone. For those of you who were not here this morning when I first introduced myself, I am ANAD's peer support group coordinator, so it's lovely to be back on for this conversation on weight stigma, racism, and eating disorders. So without further ado, I'm going to kick it off, but before we start the actual conversation, I'm going to have all of these amazing people introduce themselves because they can do a much better job of that than I can. So Clara, I'll pass it all on to you and we'll go from there.
Sounds good. Hi, everybody. Excited to be here today. I'm Clara, and I am the Executive Director at Body Empowerment Project. We are an eating disorder prevention nonprofit based in Philadelphia that works with middle and high school students, mostly focused on youth who have little access to care.
And Izzy, do you want to introduce yourself?
Yeah, hi everybody. My name is Izzy Abraham Raveson. I like they pronouns best. And I'm the executive director of YES, which stands for Your Empowered Sexuality. We're a little nonprofit in Philly that provide anti-oppressive, consent-based, pleasure-centered sexuality education to people of all ages. And sexuality education, of course, includes body liberation education and talking about fatness and fat liberation, which is a passion of mine. And I'm also someone who is in recovery from an eating disorder and a fat person. So I'm really excited to talk about this both professionally and personally.
All right, and Gabby.
Yeah. Hi, everybody. I am Gabrielle Katz, but I go by Gabby. My pronouns are she, her. I am the owner of Coastal Collaborative Care, which is a therapy practice specializing in the treatment of eating disorders, depressive disorders, anxiety disorders, and trauma. We have a couple in-person locations in Virginia and provide telehealth throughout the country. I personally am a licensed therapist, clinical social worker, and I started working in the eating disorder field in 2014. I'm a certified eating disorder specialist and approved consultant. I have that certification. And in addition to my specialization in eating disorders, I am trained in trauma therapy, including EMDR, IFS, and something called FLASH technique. So I really look at eating disorders through a trauma-informed and health at every size lens.
Awesome. Thank you so much, everyone, for introducing yourselves. And Gabby, I'm actually going to kick it back to you. And I would love for you to explain kind of this concept of anti-fatness and what it's like living in a fat-phobic society today.
Yeah, I think it's really important to start kind of, first of all, what is weight stigma, right? Like we need to first understand what is weight stigma, what is fat phobia. So weight stigma is basically like the social bias and discrimination. It's the stereotype, the negative attitudes against people based on their body weight and their body size, particularly those in larger bodies. And these biases just perpetuate the idea that people in larger bodies are less than. They're less capable, they're less healthy, they're less fill in the blank, despite the complexity of factors that influence weight. So when I think of weight stigma, it's more of like the broader societal discrimination and the negative stereotype. And then fat phobia is seriously the fear, the dislike, the prejudice against people who are fat or live in larger bodies. I think when I talk about this, I really like to kind of like explain how embedded it is. Like it's everywhere and it influences everyone and it starts at a really young age. So I like to kind of use some personal use of self. And I think about even when I was in elementary school, right? When my family would want to take a picture of me, they would always say, Gabrielle, suck in your belly. Gabrielle, suck in your belly. And like, that was when I was little, like little, like 1 digits, And so I think that just shows, again, how deeply ingrained it is in cultures. Another example is the fact that like doctors commenting on children's weight and saying they're gaining too much and they need to lose weight. Talking about like children's books, like Berenstain Bears, I used to read when I was little. And there's a whole book like fat shaming the family and demoralizing and putting like, food is good and bad. And then I also think about, I'm going on a tangent, but I'll stop in a second. But I'm also thinking about, Disney characters, or like I love Disney, and thinking about like who are the villains? They're the people in larger bodies, right? Or for example, Ursula in The Little Mermaid. So I'm saying all of this to say that this is a huge problem and it is deeply ingrained. It's ingrained in our culture. It's ingrained in our media, upbringing, medical practices. And I think, it really leads to widespread discrimination, causing trauma and overall just like really harmful for all of us.
Thank you so much for sharing all of that. And Clara, I know that you have spoken a lot about how these ideas of anti-fatness and weight stigma are really rooted in anti-Blackness. So if you could explain a little bit more about that.
Yeah, I love that I didn't include in my intro that is where my expertise lies, and what I did a lot of research on in college, and there's been a lot more research on it in the past couple of years, especially with a couple books, specifically Fearing the Black Body by Sabrina Strings and Belly of the Beast by Deshaun Harrison. But kind of where we see these ideas start to percolate is in the Renaissance era in Europe, in pre kind of Enlightenment, we see larger bodies as something that is a symbol of wealth and fertility and prosperity. And then when white people, European countries started to encounter African populations and be at the beginning of the transatlantic slave trade, they there was this idea that like Black people love sex and they love food, and for this reason they're fat, and we as white people, not me obviously, but as white people, we need to show that we are rational and we have self-control, and that makes us like the premier race of the world and why we can subjugate other people. So these things continue to blossom throughout the 16th, 17th, 18th century, where Enlightenment thinkers link thinness to whiteness and discipline and moral superiority. And this has continued to be conflated with Protestant religious teachings of indulgence is bad and gluttony is bad and larger bodies are bad, and continued into where we get into scientific racism of we have these ideas. Now we want to say, well, this is ingrained into who Black people are as people, and that especially has to do with Black women, that Black women love sex and they have excessive appetites and things like that. And it's also used as a social control for white people, and especially white women. White women were and are encouraged to maintain thin bodies to distinguish themselves as superior in the racial hierarchy. And so fat shaming becomes a way to police bodies along racial, gender, and class lines. And people often say, well, how does this show up today? And these ideas are deeply ingrained into our narratives about health and beauty standards and discrimination. And we can see them in a lot of things I talk about our contemporary public health campaigns of, we often see fat Black bodies be the ones who are displayed as these headless fat people in your ads. We see a lot of discussion about like Black women are a drain on the healthcare system because Black women are fat, even though that the data doesn't actually play that out. Actually, rates of quote unquote obesity among races is not actually that different. So these continue to show up today.
Yeah, and I feel like we could talk for hours on the history of this, but in more recent times, there has been this emergence of fat liberation and body positivity. So Izzy, would you be able to speak more on that?
Totally. And thank you both for everything you just shared. Super well put and so important. So I think body positivity is probably the word that people have heard the most of these different words, because there's body positivity, body neutrality, body liberation, fat liberation, right? So the idea of body positivity is literally just being positive about your body, right? Saying nice things about your body instead of negative things, right? Changing the way we think, using affirmations. And body positivity can be super useful to people, but it's very limited, right? Because it's very individual. It's very internal. It's like I change my own self, I change my own brain, and then I like my body. But for those of us who are experiencing the things that Gabby and Clara just talked about, right? Those of us who are experiencing discrimination from doctors, those of us who are experiencing literally not fitting into seats at theaters, right? I love theater and I can't fit into all of the chairs. Loving ourselves and being positive about our bodies is not going to solve that problem, right? Yes. And so actually body liberation says that you don't need to love your body in order to deserve and have all of the things your body needs in order to thrive in society. Body liberation is a systemic look at the way that our culture treats bodies. Body liberation says that all bodies are inherently good and valuable as they are, right? That beauty is not what makes our bodies valuable, right? Beauty is not the currency. Beauty is not the standard that we use to measure bodies' value. Body liberation celebrates all the ways bodies can be, right? It says that instead of looking how close or far we are from some standard of what's good, like the fact that our bodies are all different is what's good, right? In terms of color, shape, size, ability, chromosomes, hormones, age, and everything else, right? And that we should change the world to fit our bodies instead of changing our bodies to fit the world. Body liberation is inherently tied to Black liberation, to racial justice, to trans liberation, to gender justice. It looks at the way that all of these systems of oppression are intertwined and actually making the world a better place for bodies to be. So that's body liberation more generally. And then fat liberation in particular is all of that, but with a specific celebration and focus on fat bodies, that fat bodies are meant to exist, that fat bodies are inherently good, and that fat bodies deserve all of the infrastructure and support to live full, thriving lives. Mm-hmm. So that's my quick and dirty.
Mm-hmm. Thank you so much, everyone.
I want to do my first interjection that I'm sure we'll have a bunch of. And what I also love to say is, like, we should all be fat liberationists. A fat liberatory world is good for everybody. Nobody should have to live in a world where bodies are policed in the way that they are today. And it benefits everybody to live in a world where bodies are free and liberated.
Yeah.
With that being said, oh, go ahead.
I'm sorry. Oh. I just wanted to add that, when we talk about weight stigma or anti-fatness, it doesn't just harm fat people, right? As Clara is getting at. It harms fat people the most and the most directly, and we should center fat people when we talk about it. Mm-hmm. And also, it harms everyone, right? There are plenty of thin people who are thin because they're spending all of their time, money, and energy on staying thin. And that's oppressive, right? We shouldn't have to do that. We shouldn't feel that we have to do that to avoid oppression, right? Like, people's lives are being made smaller because of fear of becoming fat. And so that harms everyone in so many ways. Like, how many people's lives have been taken over by that one goal, that one thought? Mine was as a young person for many, many years, right?
Or lost completely.
Yeah.
You both have transitioned beautifully into kind of our next talking point, which is what can we do about this? So Gabby, I am going to throw it to you so that you can talk more about what eating disorder professionals in particular can do about all of these different things going on in our society right now.
Yeah, I just want to sit here and listen to Clara and Izzy just talk. I'm just
right?
Say more things, please. So I just want to throw that out there. But okay, so to go to your question, I think it's really important as an eating disorder professional to become aware of your own implicit bias, right? Like, as professionals, of course, I hope, we are fat positive, health at every size. We are accepting of all bodies, all races, everything, all genders, sexual orientations. And we have this unconscious attitude or stereotype that affects our understanding, actions, and decisions period. We just do as humans. And so I think becoming aware of our own implicit bias is super, super important to start. I think as professionals, we always have to do the work that we ask our clients to do. So I think first and foremost is do your work, become aware of your own implicit bias. Harvard has like an implicit bias. Like if you just Google Harvard implicit bias test, they have a ton of them. Highly recommend them as like a starting point. I also think we need to be aware of our language, right? So when we're talking to our clients, we want to move away from anything pathologizing, right?
Mhm.
Anything pathologizing in regards to bodies, in regards to weight, size. We really need to move away from the pathologizing. I also think as an eating disorder professional, we need to watch what we say when it comes to our clients' weight changes, right? We don't want to reassure anybody about a certain weight thing. We don't want to promote that the body's going to go in a certain way. Like I think back in the day, a lot of eating disorder professionals would say, oh, you know, your body is going to get to this number and it's going to stay there. That's not how bodies work, right? Or if you change your relationship, you could lose weight. Why are we talking about that, right? So I really think we want to promote a body acceptance approach. We want to promote that neutrality, and we want to keep that language out of our mouth. A couple more things that I think are really important is one, educating our clients on this. Like what we're talking about today is what I would talk about with my clients too. Like educating them about fat phobia, weight stigma, you know, all these things, fat liberation, health at every size, fat positivity, anti-diet perspectives. Just give them the information so they can actually have that perspective shift. I think that's really important. And then the last two things I'll say is one, I think it's really important for the space to be very safe and supportive and inclusive. So making sure your furniture can fit all bodies, making sure you have artwork of different bodies and races and everything and genders. And I think that's really important. And then I also think being an advocate systemically and within your society, like doing something like this, and you know, if you can or however you can, just being an advocate for these changes, being an advocate for, you know, fat positivity, body liberation, because we have to walk the walk, right? We can't just talk the talk in sessions. We have to really walk the walk.
Can I just say how much I love how you said weight change rather than weight gain or loss? That's actually a guideline we have in our support groups, to use that terminology rather than weight gain or weight loss when talking about body changes, just to keep it more neutral. So the fact that you plugged that into your conversation and
I didn't even know you guys did that, but that's awesome.
My heart fluttered a little. I was like, thank you. So Clara, I'm going to throw it to you now, because I know that part of your job at the Body Empowerment Project is to educate school professionals on these issues and topics. So can you please explain a little bit more about what school professionals can do?
I'm honestly not going to say that much different than what Gabby just said. I think I'm going to start with being aware of implicit bias. We know that fat students are disciplined more. We know that teachers believe that fat students can achieve less in their classes. We know that teachers think that it tends to weight and size tends to be the most common reason that kids are bullied. And it means that fat students tend to have lower grades, have higher absence rates. And so making sure that your space is inclusive and affirming to all the students in your space is really important. Making sure the desks in your classroom aren't all those like little desks that are like attached to the back of the chair that like nobody can fit into comfortably. Making sure that they're, even without asking or being able to understand that maybe not everybody's going to fit there, so having one in your classroom already. And this is hard, especially I work in mostly Philadelphia public schools. I know that's not an option for all people, but trying to think about these things early on. I also think being aware of what I say to teachers a lot is being aware of your own diet talk. I go into schools all the time and we'll have pizza one day, and I'll ask the teacher who works with us or the teacher in the classroom, like, hey, do you want a piece of pizza? Do you want a donut? They're like, no, I can't be bad. I'm being good today. And I've just spent 10 weeks telling their kids not to moralize food, and then they just do it. And I often think the work that I do with students, the teachers honestly need it more and adults need it more, but that's a whole other thing. And I think for specifically nurses, counselors, gym teachers, being aware of your language as well. I know it's common practice and sometimes law in states that you must weigh children in schools, letting children step on the scale backwards, making sure that you do it in a private area, making sure you don't even have to tell students their weight, because oftentimes what happens is then other kids come around and they're like, well, what did you get? What am I higher or lower than you? And those conversations can be so traumatizing, and I still think about them as an adult. And so that was a host of things that I don't even know what my ending point is. But I think all in all, just making sure that your language, your space, your own voice is inclusive and affirming to all of your students.
Okay, I have a question for you. Why is that a law? Sorry, that's just so, I didn't know that. What is that?
There are some states that required what is like canonically called BMI report cards, where every student must be weighed and their BMI sent home to their parents.
And that's like, you have to do that.
Yeah, there are many states where that is law.
And the answer to why that is because there's a false equivalency with BMI and health. And there's a false understanding that shaming children about their weight is health promoting, when we actually know it is devastatingly the opposite, right? It is deeply dangerous.
And shaming parents for their children's weight. And I think this is especially true for mothers, we see your child's weight or your child's body as a reflection of your parenting. And so if your child is fat, it is a failure to you as a parent. And that is one of the things that we, as a society, want to push with something like these BMI report cards, of this is something that is your fault that you have to fix, even though bodies are not meant to be fixed.
Wow.
With that being said, Izzy, can you touch more on what parents and healthcare professionals can do with regards to all of this?
Yeah. First, I just want to say that we're talking a lot about implicit bias, but I want to name that there's a lot of explicit bias in these fields, like really explicit bias. Like, it is really, really common / almost universal for people in fat bodies to be taught by their healthcare providers and their parents eating disorder behaviors as health promoting, right? Like, I literally have had doctors and teachers and other adults tell me to restrict my food in a way that is disordered, right? Which is what helped me develop my eating disorder, because I was in a fat body. I've had a doctor, after I was diagnosed with an eating disorder, tell me to keep it up because I was losing weight. And I said, I have an eating disorder. And she said, whatever you're doing, keep doing it. So that's explicit bias, right? And so I just think we really need to name that. I could say so much more about all of this. I could go on forever. I will say first that on our website at YES, which is yourimpoweredsexuality.org, we have a free resource for how to practice and build a culture of body liberation with young people. So for parents and educators, I encourage you to check that out. But a few strategies from that. We've talked a little bit about modeling positive self-talk, even when we don't feel good about ourselves. And that's not like a toxic positivity thing, right? It doesn't have to be like, I love myself all the time. But saying things like, I don't always feel good about my body, but even when I feel bad, I try to find something to appreciate. Or I love how soft my hair is. Or my body's changing as I get older. And sometimes that's confusing, but it's also cool and interesting, right? Just noticing how we're talking about our body, even when we're feeling negatively, because kids learn how to talk about their bodies from us, from the adults in their lives. Something I really want to talk about is how often we accidentally communicate to kids that fat is a bad word if they say, like, oh, that person's fat. And we say, shh, that's rude, right? Don't say that. That teaches kids that it's bad to be fat, right? So a different way to respond to that kind of leans into a consent framework, which is, of course, as a sexuality educator, my bread and butter, to say something more like, hey, like, that person might not want you to talk about their body right now, but it's really cool that you're noticing that bodies come in all different sizes, right? Mm-hmm. You might want to pull that kid away from that person that they're talking about so that they're not hurting them, and also say, like, yeah, you're noticing how different bodies are. That's awesome.
Mm-hmm.
I have a million more of these. I know we're running out of time. But one more that I really want to emphasize is normalizing that bodies are meant to change always throughout life, right? We often talk about puberty as like the transition from a kid body to an adult body, and then that's that. And because I went through puberty at 11, I thought my 11-year-old weight should be my weight for the rest of my life. That's nuts, right? We need to talk about how bodies are meant to keep changing. Change of bodies is scary and is hard and is an adjustment and also is beautiful and is life. And like, we need to talk to kids about that.
Yeah.
And then for healthcare providers, a lot of what we already heard is relevant to you too, like making sure that there's more than one bench in the waiting room, that there's actually seating people can sit in, that there's cuffs, blood pressure cuffs that fit around people's arms, that things like, for COVID vaccines, fat people need different needles, right? That you're educating yourself on the actual equipment. And that you ask your patients what their goals are, right? Don't assume goals for them. Don't put weight loss onto them. If they say my goal is to lose weight, ask questions, right? Help educate. And just please don't use BMI and weight as a stand-in, as a shortcut for health, because it's not, and you'll miss things, and it's dangerous. And so yeah, again, I could go on, but I'm guessing it's time to
I mean,
transition.
We could talk about this for hours, and I knew that we could talk about this for hours, and a half hour wouldn't be enough. So hopefully there are future conversations about this. But one point that I would love for us to end on is, how can individuals take care of themselves with like all of this going on in society today? What can they do to take care of themselves?
Mm-hmm.
Yeah. So if you're a fat person with an eating disorder, first of all, I love you, care about you, glad you're here. Make sure you have other fat people in your life is like the best advice I could possibly give, whether it's virtual or in person. Having a fat friend, having a fat community is incredible. Especially fat people who have a fat liberation perspective. There are fat groups on Facebook and in other places, and I think they're really unbelievable resources. And also, just like a little trick that I think is so minor but so helpful is like when you're having a negative thought about your body, to just be like, whoa, fat oppression's really intense, right? Instead of like, oh, my body's bad. It's a little reframe to be like, anti-fatness is affecting me right now, right? I'm having bad body image thoughts, not my body is bad. So that's my quick suggestions. I'm gonna leave room for other people.
I want to quickly, go ahead.
I was gonna say mine's directly related to that. Of honestly, what was most helpful for me was learning about like the roots of anti-fatness and how that related to anti-racism, and like especially as somebody who was like my degrees in Black studies, that was something that was really important to me. I got angry, and that's not going to work for everybody, but I was so mad that I didn't know any of this, and all of it made so much sense, and I was treating my body in a way that was antithetical to my values and my beliefs about the world. And I can still continue to be angry and try to fight for systemic change, and that is where like my self-care lies.
Yeah, I'll just kind of go in a different direction a little bit of like, I love everything, agree with everything, and give yourself compassion. We do live in a very anti-fat, anti-bias, fat-phobic society. If we have these little thoughts in our head, the fact that you realize you're having it, that's progress, that's healing, and that's powerful. So just also give yourself compassion that this is something that's embedded, like I said in the beginning, and the fact that you're here, the fact that you're learning about it, the fact that you are noticing it, that is huge. And that's a step in a more body liberation, fat positive, health at every size direction.
Yeah, I always say, like, first of all, it's not any of our faults that we don't like our bodies. Everyone's doing that so on purpose to us, right? Like there's so many people's interests and money interests and oppression and power interests that are teaching us to dislike our bodies on purpose. So it's never your fault. It's never our fault. And second of all, like, we don't want to add another thing to be ashamed about. Like, I'm ashamed of my body, and then I'm ashamed of being ashamed of my body because I know better, right? That's not it. That's not it.
Yeah.
Well, we are out of time. Thank you again, Gabby, Izzy, and Clara. You are doing amazing work in the community and raising awareness of all of these issues. So thank you from the bottom of my heart. Thank you to all of you for tuning in, and we will let everything transition to the next streaming thing, whatever's that's going on. So bye.
Bye. Thank you.
Thank you so much, everyone. It was so great having you. And everyone watching are going to see just a little bit of a transition here as we switch into our next thread. So see you in just a minute.